Hi friends, I'm Dr. Swapna Chekuri from Hyderabad Women and Fertility Center. Welcome to my channel. Today let us discuss about umbilical hernia in pregnancy. See, most of the individuals they develop hernia during pregnancy because during pregnancy as and when the baby grows, intra-abdominal pressure also increases. And suppose if your abdominal muscles are weak or if they are lax, then chances of developing umbilical hernia are more. And of course, there are some precautions where you need to take during pregnancy just to prevent the development of hernia. Like you need to avoid constipation, take adequate hydration, and maintain your overall health and improve the tone of your abdominal muscles by doing yoga or breathing exercises. So these are all few things which you need to follow to avoid development of hernia. But of course, in spite of taking all these precautions, some individuals they do develop hernia when their abdominal muscles are weak, or because of increased laxity of the abdominal muscles, or in case of twins because of increased intra-abdominal pressure also they can develop hernia. And in case of any previous surgeries which can lead to a weakness of the muscles, then also they can develop hernia. And in case of polyhydramnios where amniotic fluid is more, or in case of a big size baby, if there is any big baby, then also the chances of developing umbilical hernia are more. So what we need to do? See, basically if you have hernia, we usually ask the lady not to strain too much at stools. She should avoid constipation, take adequate hydration and rest. And most important is like we usually advise an abdominal belt as well. So belt is just to keep a support and it prevents the increment of the size of the hernia. So it just maintains the size of the hernia. That's the only precaution which we can take during pregnancy. And there is no need of surgery as such. Only there is one indication where the lady has to go for a surgery, like in case of a narrow neck hernia. Suppose if the bowels or if the omentum, that the fat content around the bowels, if they get stuck over there, then that's the only indication for surgery. So then the patient, the lady complains of severe pain, not able to eat, not able to sit. So that's when we do a scan to see whether it's an obstructed hernia or not. If it is obstructed hernia or incarcerated hernia, then always it's mandatory to go for a surgery. Suppose if the size of the hernia is big and the neck of the hernia is wide, then even the bowels, if they come out again when she lie down, when she take rest, the bowels and the omentum they goes inside. So even in those cases also we don't advise surgery during pregnancy. At the time of delivery, if she is going for a C-section, cesarean, along with the cesarean we can do simultaneous repair of the umbilical hernia if it is big. But of course if it is small, no need of surgery. We usually ask the lady to wait for 3 to 6 months because within this time most of the things come back to normal. Once the intra-abdominal pressure comes down, automatically in case of a small hernia that will get settled down. So as such surgery is not indicated during pregnancy, only in case of a complicated hernia, or if it is getting obstructed, or if it is an incarcerated hernia, then that's the only indication for surgery. So friends, in this video we just discussed what are the causes for umbilical hernia and what precautions you need to take during pregnancy, and what are the treatment options available for that. And if you find the video is nice, if you find it's informative, please like my video and share with your friends and needy people. Thank you.